Nenuha and Maria Teresa. Good morning, Anusha, Rosemary, Hemalata, Mangala Rupini. Welcome you all once again. And thank you so much for giving me this space for reading our Guru mentor, Dr. Praful Vijayakar sir's books. And today also we are reading the same book. Today, actually, we have come along to the last chapter of this book, actually. So little more pages are to be finished. And after this, we shall go to the next book. In our last class, we couldn't finish that. So today we have been reading, we are planning to read the continuation that is about the practical hints. Very, very important. So, and then the conclusion. The conclusion part is also so very interesting, and it is actually the gist of the entire book regarding Miasm. So that also we shall read. Are you all ready for today's class? For today's
Good morning,
reading?
ma'am.
Yes, good morning, Nancy. Yes. Yes. Thank you, dears. Thank you, Rosemary. Yeah. Thank you, Swati. Yes. So it is all about, so we have talked about many hints, actually. Very, very useful things. We have talked about abrotanum. We have talked about many things. And today we are reading about the danger of MRI scanning. So Vijayakar sir was actually he has got that progressive thoughts, and he always have given importance to the investigations, including CT, MRI and all that. And why is he saying that MRI scanning? Is there any real danger? What does Dr. Vijayakar sir mean here? So according to, from his experience, he understood that like where should we write for the MRI and where should we not? See, for anything and everything, we cannot simply write down the investigations, especially if it is an investigative, if it is an invasive investigation, we have to always think twice. And if any non-invasive investigations are available, we have to always go for that. And when to prescribe MRI, when not to prescribe MRI. So let us go through this paragraph today. So according from Vijayakar experience, there was a fast-growing astrocytoma. Okay, so it was a brain tumor which was operated and it grew again. See, it is a fast-growing tumor. No, it grows again and again. When the case was seen by me, she was in intensive care of Jaslock Hospital, lying unconscious. She was very chilly. Since young age, she was very reserved, introverted, much responsible, religious, conscientious, diligent to the extent of working in the kitchen, even severe headaches and giddiness before she was hospitalized. So this was the short case. So this was the personality of this person. She used to suffer from sun headaches off and on since childhood with increased thirst, and she had desire for bread. Now, what is the medicine that is pulsating in your mind? So it is some natrum group, no? On the above basis, she was prescribed natrum carb 30 single dose. She became conscious and she was brought home and started walking, talking, and finally dancing too. Now, let us stop here and have a small discussion. So, what do you infer from this? Even our master, Dr. Samuel Hahnemann, has said that even when no external symptoms are there, no, like initially the patient had external symptoms because of some diagnosis, and after a certain medicine, after the GCS or the constitutional simillimum is given, there is disappearance of the external symptoms, means the internal disease itself is gone. So this should to cross check that at this point, maybe after some time, not immediately after the cure. Now the patient who was unconscious is got up with full vitality, and there is no convalescence at all. She got up on her feet and she is all into the kitchen and even to dancing. What does that mean? Her vitality is all the more active and she is fully back into health. Now we don't want to cross check that, not at this juncture. Now what happened here? She went on to get her reinvestigated. This happens very often, and sometimes we spoil our case too. So this is a real eye-opener that there is no hurry to do the reinvestigation. Wait for 1 month, wait for 2 months, wait for 3 or 4 months. Look at the improvement of the patient, and you can assure that since you're able to do the purpose of your life, the higher purpose of your life, and since you're fully active, it is understood that there is no disease in you. And Maybe if you want to do a check or something, go for something lesser, maybe a CT, not a real MRI and all that, or maybe a normal scan if it is possible. No, like for internal organs and all in the abdomen and all. Don't go for endoscopy again and again, or don't go for colonoscopy again and again. Maybe you will have to take some time for all those things. So here she went on to get her re-investigated on her own insistence and against my advice. So Vijayakar sir had warned her not to go for MRI immediately because it itself is a magnetic resonance image and it can cause damage. And to everybody's surprise, the MRI showed complete regression of the tumor. Happy? All are happy. This is what we have expected, and this is what our inference was. Even our master Samuel Hahnemann was insisting this only. Once the symptoms are gone and the patient is back to health, the disease per se is gone. So that was shown in the MRI also. So everybody are happy momentarily. They were happy, but I was apprehensive. My worst fears came true as she developed giddiness 3 days after. 3 days after the MRI. The MRI done within 3 weeks showed a regrowth of the tumor. So, how fast the tumor has regrown. She became unconscious and died in about 6 weeks' time. Yeah. Repetition of natrum carb, changing of potency, or changing of remedy helped her. The question is what happened and why this happened. Everything was all good, no? Even we all had cases like that, I'm sure. So, see, these things are, they will teach you some hard lessons. So, you become a great doctor only after 10 years of time. Immediately at your practice, you will be curing cases, but then you are not an experienced doctor, or you become a full-fledged doctor. The patients will teach you a lot, and all the experiences, good or bad, will teach you a lot, and you become a matured practitioner, maybe only with 10 or more than 10 years experience. The more elderly you are, the more kind of cases you are seeing, and the more experience you are gaining out of that. And Vijayakar sir, through all his experience, he has understood that. And there is no hurry to prove that, okay, I have cured the brain tumor. Come on, with one dose of natrum carb 30, no, like youngsters and all will want to prove that, no. So many cases, it will rebound. In no time, it will rebound. Actually, it will come back, it will bombard the entire case. So when a case is fast cured, how do you expect a cure for astrocytoma? Similar syllabus again. It is not a slow growing tumor. Hence, since it is a fast growing tumor, the result also will be fast. It is just like an acute thing. Suddenly, in one day time itself, you will see the improvement. And we don't want to complicate that by another energy. Force first. Now the vital force is like this, tuck, 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 like it is in a delirium moment. There was unconsciousness the other day. Today it is fully consciousness, and the energy level is to the peak. And at that time, it is advisable to be calm, to be at rest at home. Don't go for any super excitable things. MRI is one of the super excitable things. And the worst fears of Vijayakar sir had come back. What was that? Like the regrowth of the tumor in no time, and it could not be curtailed thereafter, and the patient succumbed to death. The question is what happened and why this happened. The answer is simple. MRI had caused the regrowth. But can a non-invasive technique of MRI cause tumors? Yeah, MRI, the strong artificial magnetic field. The cells and tissues are influenced by the strong field in such a manner that the magnetizable elements inside the cells are aligned in a certain manner. So when a human being is perfectly healthy, it is fine. You can advise for MRI because his vitality is not at the delirious state. In delirium, it can jump this way or jump that way. It is just like the cat on the wall in delirium. So if it jumps this way, it is well and good. But then you will have to keep the fingers crossed. So, but if it is a slow thing, you can always advise for MRI because there you have got control and the vital force is not in the delirious state. The vital force is stable there. You can advise MRI. And your cells, the magnetizable elements inside the cells are aligned in a certain manner. When the magnetism is stopped, the elements start realigning themselves in their natural place. This process is picturized to find the existence of tumors and destructions. So then what is the mistake happened here? So suddenly when, see, the vitality or the vital force is not yet fully cured, it is on the verge of getting cured. The thing is gone. The result of the disease is gone. But then the vitality is yet to be stable. So at that moment, the personality like natrum carb, who is highly sensitive to anything and everything, it cannot bear another anything like MRI, not only MRI for that matter, any bad energy or any vibrations the person is not able to bear. The constitution is not able to bear. Unfortunately, the constitution was that kind of a highly sensitive constitution. So this aligning and realigning of internal elements of the cells and tissues amounts to injury. You would have seen that in many cases nowadays, young girls are even coming up with fibroadenomas. There will be multiple fibroadenomas or cyst kind of things or fibrocystic things studded everywhere in bilateral mammae. And it will be very small also. Sometimes it will not be even able to palpate. Sometimes little bit of tenderness will be there at certain areas. So the doctors immediately want to do the FNAC. They want to do the biopsy. And the biopsy can be done only if the tumor size or the cyst size or whatever, the lump size is a little bit bigger, like maybe at least 2 centimeters it should be in order to prick the needle, and it is movable also. So sometimes the prick will not fall exactly upon the cyst or upon the tumor, and the one or two chances will be missed. So one or two simply the injuries will be coming upon the breast tissue, which the person don't like, or which the person can't bear the pain. And upon the private area, like such kind of pricks coming on, nobody will like that. And what happens? It gives a prick in the mind also. There will be indignation, and anyway, the body has gone into the psychotic phase. That is the reason why the cyst is coming up or the tumor is coming up. So unfortunately, if it is a syphilitic predominance, it can immediately go into the syphilitic phase or the psychosyphilitic phase. The behavior or the cell's behavior can change just because of that injury. If you have left it at that moment, the tumor can still grow, but then it will grow in a very slow pace. There is no hurry to change the gear into the next miasm. Hope you got the point. How many of you understood this point? When to give a mammography test and when to give an FNAC test. Yeah. So when will you give an FNAC test? You preach about all kinds of diagnosis. You preach about all kinds of gradations in cancer case. Yeah. In order to treat a cancer case, you need to know the gradation of that, etc. No. Yeah. Then without investigation, how are you going to treat a cancer case? It is impossible. So, but then what is the thing? What is the important thing here is,
Sorry to interrupt.
yes,
Hi, ma'am. Can you repeat that? That's what
yes,
when to do the mammogram.
yes, that is exactly what I'm giving you through an example. Suppose a patient is coming up, my internet connection is unstable. Am I able to, are you all able to hear me?
Yes, ma'am. Yes.
Yes, okay. So, when a patient is coming to you with a fibroadenoma, with your clinical knowledge and with by proper inspection and palpation of the breast tissue, will you be able to understand that this is a fibroadenoma, or this has got that stony hardness or irregular margins, or it is stuck to that tissue in the background, and do you still have a suspicion? See, any doctor will be able to understand whether this is a fibroadenoma by mere palpation. Are you with me? Have you understood that? Fibroadenomas will be movable and it will be soft. Yeah, it will be firm, but then it will be having round, smooth edges and it will be movable. So you will be able to understand that with mere palpation. Then why do you have to send the patient for mammography? Mammography is the question. And is there any need for a needle biopsy there when you have understood that this is a fibroadenoma? But at certain cases, with the fibroadenoma itself, you will be having your own doubts and fears in your mind that this doesn't look like a normal lump. There is something fishy here. When you have that doubt, then you give the patient for, then you send the patient for, when it is of a proper size, Okay, then only you have to do the proper investigation. You have to save the patient. You have to treat the patient with responsibility. You have to treat the patient knowing what it is properly. There are different kinds of breast tumors. What is the stage of this disease, and what is the kind of breast tumor that you are going to treat? Is it a fast moving thing or is it a slow moving thing? All these things will be like you will be able to assess all these things by looking into the biopsy report and the mammography report. So when you are at doubt or when you have that suspicion of a malignancy, then all these investigations are good enough. For example, for another Dr. Bharti has got a doubt. I'll clear the doubt immediately. Do you have a doubt? Okay. So, yeah, if it is a case of multiple small cystic things inside the breast, and it is not even palpable properly, and sometimes they do the mammography, that itself can be injurious. And the second thing is they will be doing the FNAC, which is almost very difficult to do because the swellings, the cystic things are smaller in size. So even the FNAC will be treacherous because it is movable also. You will not be able to direct the syringe properly exactly into the swelling because the swelling or the cysts are slight or are of a smaller size. If it is of a proper size and if it is kind of staying there, then the FNAC can be done with one prick. That means with the minimal injury. You got the point? Yes or no? Yes?
Yes, ma'am.
So what happens is in the okay, so in the doubtful case where the swelling size is there and with one prick of FNAC, all those things are done and you are getting the report, all is well, all is done well. So that you get the report and then now you know the gradation of the cancer and your treatment plan will go on. In the second case, where there are many cystic, small cystic things, if the lady or if the girl undergoes FNAC, how will it be? It will be like uh, throwing for the mangoes by blindfolded. Yeah, sometimes you will get the tissue, sometimes you will not get the tissue. There will be many injuries, and the lady does not like that. Mentally and physically, it is a trauma. So one more trauma, one more additional trauma happening can change the gear into the syphilitic miasm. This is what I wanted to tell you. So at this time, when you know that, okay, with the mammography report, it is only fibrocystic disease or certain minimum or FNAC, you will save a case. You just give them the proper treatment, considering it as a benign tumor. By looking into the birads, you will know that it is a benign or a malignant. Only if it is birads of a higher thing, you have to go for the FNAC thing because there already the syphilitic miasm has set in. And now for you to put a treatment plan, you will want to know what the gradation of the or what kind of the cells the tumor cells are. In the other case, in the totally benign case, where it is very evident that it is totally benign, don't send for FNAC. Yeah, hope you got the point. So this is exactly what we are going to read here. So let us read the paragraph. This aligning and realigning of internal elements of cells and tissues amounts to injury. Even Hahnemann mentions it in aphorism 73. He mentions about meteoric or telluric influences. No, like MRI can be considered as a meteoric or telluric influences, which are essentially strong magnetic influences being injurious to cells and hence exciting the cause. He has mentioned them only in acute diseases tendency, and that is physiological, and we understand by now that the strong psychotic constitution goes to the second defense, that is constructive defense, immediately and quickly. So as long as the patient is in the soric phase, suddenly if any meteoric or telluric or even magnetic influences have happened, some injury has happened, if the patient is having a predominantly psychotic miasm in the background, after exposure to such kind of a trauma, it can immediately jump into the psychotic miasm, into a full-blown psychotic miasm, where the meteoric or telluric influence, even an MRI in that case. Yes. In this case too, the cells of nerves, that is the astrocytes, which were limping back to normalcy, were coming back from psychosis to SORA. The patient is already in the psychotic phase, and now after natrum carb, it is coming back to SORA. At this stage, the cells or the astrocytes are very sensitive to slightest irritation. MRI irritation was enough to injure and produce the constructive defense, which was genetically inherent in this constitution. So in this constitution, it was a predominantly psychotic miasm. From psychosis, with natrum carb 30, it was brought back to SORA. And now the vital force is in the soric phase, it is in the highly sensitive state. And again, one full-blown MRI is given. What happens? The miasm changes again from SORA to even more fierce psychosis. So because psychosis is the genetically inherent miasm in this constitution, this led to the... All are with this? All good? Yes. Yes. So see the next paragraph. This cannot happen in all cases exposed to MRI. This is just like vaccination. We cannot take ailments from vaccination in all the cases who have underwent vaccination. Almost 99% of all the people have underwent vaccination. Many of them don't have any reactions. Only certain constitutions which have the reaction has to be, only for them such rubric has to be taken. So this cannot happen in all cases exposed to MRI. Only those constitutions who are oversensitive, like natrum carb, run the risk. It is best not to do a repeat investigation if the patient shows such a drastic, unimaginable improvement. If it is a sudden improvement, if it is a fast improvement, then better to sit with crossed fingers. No, like don't let the patient do this and that. You have to go slow. You have to ask the patient to be cautious. Doing biopsy itself intensifies the malignancy. Is this holds true? 100% right. Yes. Yes. Correct. But then at certain cases, biopsy has to be done also. Keep that part also in your mind. Only for those cases which will help you to do the prescription. Only for such cases, the biopsy has to be done. Or see, only where you have that doubt, you have to send them for the biopsy. If you don't have any doubt that you know that this is totally benign, don't send them for a biopsy and turn them into malignant. This is the warning, okay? Hope you understand this. So, investigation at this stage, yeah. So it is best not to do a repeat investigation if the patient shows such a drastic, unimaginable improvement. Investigation at this stage does not serve any constructive purpose. I shall give you an example of a cancer specialist who is in the north, a homeopathic doctor who has been practicing since many years, and he has got a very, very successful practice. And there, it is kind of a remote village. So there the people are not bothered about the investigations at all. When they are sick, when they are down with cancer, they go to the conventional medicine, and there all the tests are being done, all the investigations are being done, including the... And they come to this homeopathic doctor for treatment. And this doctor analyzes it and gives them the treatment. And the tumor is disappeared, the cancer is gone. Again, the symptoms gone, the syphilitic pains are gone, the patient has put on weight, the patient is able to eat properly, the generals are all healthy, and the miasm is changed from the syphilitic to psychotic and then to SORA. So maybe from the syphilitic to psychotic phase where the patient has put on weight, etc. And the symptoms are gone completely. Nor they do have the money to go for the investigation, nor they are interested in all such things. They want to go to the field back for their work. They are all of that kind of a soric people. What do? The next day itself, they get up from the bed and they go for the work. Kheti karne ke liye jate hai. What happens? They do their kheti for how many years? For more than 10 years, they are not back. And their relatives are all coming, and the doctor still has the follow-up with all those cancer cases. The doctor knows that what kind of a cancer he has treated. He is still keeping the, it is proved that the patients are all doing their higher purpose of existence. But then is there any evidence that he has cured the cancer? There's no evidence, because the MRI or the investigation is not repeated. But then for the good of the mankind, that doctor is not bothered about evidence that he has cured the cancers. He is also doing a selfless job. He only thinks that, okay, as long as the patient is happy, I'm happy. They are able to do their higher of the physician, not again sending them for such kind of trauma, of money trauma, time trauma, and pain trauma. Do the all these examinations again, and then sometimes no. Yeah, sometimes what happens? The cells, no, like they are already in the verge of psychosyphilitic and all that. No, body is going on and on and on in the same and nothing happens, well and good. If something bad happens, why unwanted trauma? Yes, so that is one good answer for that. Even biopsy or to injure a tissue whose genes are already defending hyperconstructively. Does that mean that patient doesn't know about the severity of his disease? Yes. So my mind is helping him to cure too. Yes, with homeopathic medicine. Yes, Kusum. Because it is ignorance is bliss sometimes. You don't want to know more and more about your disease. You want to know the purpose is good, and the doctor has confirmed that all is well and good. It is not palpable now, it is reduced. Believe your body, believe yourself, and believe your energy levels. Believe your sleeping patterns and your eating patterns. Previously, how were you? How did you suffer life? Yeah. Again, if you want to prove that you are all good, and sometimes no, like when you are for the, yeah, certain growth are good not to be treated. That is another question. How far it is true? Certain growth, like if it is the psychotic growth, a very slow growing thing, or rather it does not have any growth at all. After a certain time, it has stopped by itself, and some calcification is going on, or some capsulation is there, where the body itself, the defense mechanism of the body itself is protecting the tumor. This tumor can act as a protective tissue for you. No need to remove that tumor. Yeah. For example, a very harmless thing like a lipoma, okay? A lipoma, it is rather huge in size, and the patient is already having a syphilitic background, like if he is having a polio, or if he is having a paralysis, or if he is having a cancer, if he is already a cancer survivor, then if the it is better not to treat that lipoma. Is that lipoma causing any trouble to you? No, no, no trouble at all. It is only a cosmetic thing for me. So now, do you have any symptoms of the syphilitic symptoms like of cancer of or any syphilitic symptoms in you? No, nothing is there. I am all good. Then what is the need for treating that psychotic thing? Because it more destructive to the constructive thing. So that is better because it is not doing any harm and it is rather benign. Keep off your hands. So in every case is different. And in every case, you have to judge from what miasm to what miasm it is coming up. Yeah. And is this really to be treated? And a physician, the best physician is the physician who prescribes the least. Yeah. You should know what is detrimental, what is inimical to health, what is killing the patient. Only that thing you have to treat. If this is all good and if it is not causing any trouble to the patient, and if the patient is having a predominantly syphilitic miasm, always best not to give any, not to treat that. Hope you got the answer, Dr. Jaidev. Yes, all good. Yes. So even biopsy or fine needle aspiration cytology is invasive procedure, which is bound to injure a tissue whose genes are already defending hyperconstructively. Already the miasm is in the psychotic miasm. So anytime it can, if it is a predominantly syphilitic thing and all that, no, like it can, who knows, it can immediately go into the syphilitic thing. Yeah. So don't give them an injury. Don't give them an unwanted injury. You have to use your judgment there. We find in daily practice that malignant tumors get aggravated after biopsy. Even after screening, no, all these ladies who are doing screening for mammography every 6 months or every 1 year, they are simply going for mammography, and eventually they will find out something, and they will do the FNAC and they will confirm that a 1% of malignancy is there, and they start treating for that, and this goes on and on and on. Yeah, here and all, no, like ignorance is bliss at certain place, at certain things. Only the maximum thing is maybe kind of self-examination, or if you are in doubt, the patient will come to you, no, like just check them, do a physical examination and give them the confidence. That is enough. If you are in doubt, go for investigation. Who is against investigation? But don't do investigation unnecessarily is the warning here. Psychotic constitution people are liable to be more affected by prolonged grief. Yes, very important. It is something like an iron bar which undergoes stress for longer time and gradually changes its shape. So this grief, no, the prolonged grief, it will be there in the mind. Maybe from childhood, the grief will be there. And eventually it takes shape in the form of a tumor or something hidden, a hidden pathology inside you. And when you trace back, no, like it will be starting from a point of grief, abandonment, or some grief or some loss of somebody very close to them. And from that time onwards, the sadness comes in. And of late in our prescriptions also, we have been amply using sadness rubrics for psychotic cases or psychosyphilitic cases, where there is predominance of psychosis. Sadness rubrics will help you to enter the case. The psychotic constitution people, therefore, mostly suffer from gradually progressed psychotic diseases under stress. Yeah, very, very slow growing things. Vice versa, if a person comes with gradual progressive psychotic diseases like diabetes or tumors, it is more likely that this constitution has been affected by some prolonged grief, mortification, vexation, or indignation, and not from anger, fright, or sudden joy. So this anger, fright, sudden joy are all for the soric things, or maybe sorosyphilitic things, not for the psychotic. For psychotic, it will be grief, prolonged grief, domination, mortification, vexation, all these things in a higher grade. Yeah, that will be like more towards the sadness. If it is mortification, then you can even think about the rubric sadness from mortification, something like that. No, like grief, sadness, and all you have to combine there in order to tackle the psychotic thing, because it is a slow progressing psychotic disease. Now coming to the syphilitic constitution. Syphilitic constitution people are liable to be more affected by anger or fright, and thus suffer, etc., where there will be destruction. So this angry, rage, and all, no, maniac, so severe violence, fright, severe fear, severe high grade of fright. All those things are fast moving things, and it can cause the syphilitic gear to be activated, and sudden diseases like motor neuron disease or infarcts, paralysis, etc., can occur. Stroke can severe rage or anger, no, some family disputes, and you have exalted yourself to the most, and so much of violent anger was there, and anger breaks or bleeds, no, anger can bleed, it can break a blood vessel or it can break a bone. So anger breaks or bleeds. Now the 13th point is, most of the time it has been seen that patients suffering from cancers, when get cured of cancers, are left with diabetes, which is as good as a compensatory cure, as disease comes down from the third defense to the second defense. Did you understand this? From Vijay Sir's experience, when he has treated cancers, that is of the syphilitic miasm, the patient recovers fully from the cancer, but then another kind of thing, another disease comes in, and that is the psychotic thing, that is the accumulation or hyperglycemia, here, it is a Herring's law. So for Herring's law, we don't give treatment. No, we just wait. Tumors which are due to constructive miasm and are more stable when or renal stones, which is a welcome sign. Yeah, got it? From syphilis, it is coming to psychosis and you have to wait. Or you when a patient suffers from grave diseases like cancers and tumors, etc., he cannot get common diseases like cold, cough, or fever, etc. Why? Because the layer of the disease is at the seventh layer, not at the first or second layer. Thus, presentation of these common patient is getting cured. What does this mean? After giving the GCS, the pain of the cancer, etc., the syphilitic pains are all getting better and the size of the tumor is getting better. And now you have not done any investigation. And now there are sure shot signs, like there are diseases coming up in the lesser layers, like upon the first layer or upon the second layer. Cold, cough, viral fever are all coming up. And then you know that, yes, the vitality of the patient is getting better and the miasms are coming down from the higher miasm to the tumor viruses, human papilloma virus, Epstein-Barr virus, hepatitis B virus, hepatitis C virus, human T-cell leukemia virus, all of which are tumor viruses, initiate psychosis or constructive defense, followed by syphilis or destructive defense pathology. When a patient is being cured of malignancies caused due to these, they might develop growth pathology like warts or polyp, which is welcome. So all these things are the tumor viruses, and which has eventually, upon that low vitality patient, if a tumor has been produced, once you have given the GCS, the tumor or malignancy are all reducing, all those things are gone, and small polyps or warts are coming up. It is a welcome sign. Where have you seen this? In many cases, no, like where there is a this ulcerative colitis or maybe the CA rectum or a CA colon, where there is affection of the large intestine and there is a cancerous affection there. After treatment, what happens? Polyps occur. When the next colonoscopy is done, polyps occur. There are many, many polyps. What are these polyps? They are psychotic, constructive thing. They are benign. The malignancy is gone. The ulceration is gone. The pain is gone. The bloody stools are gone. Now the stools are formed and the patient has gained weight and the patient is all confident. And maybe for the general examination they are going, and if any investigations are being done, if a colonoscopy is done, the report is coming up as two polyps coming up. Many polyps are there, warty or polyp-like growth, which is welcome. Now the next paragraph. Chickenpox virus, which also causes herpes zoster, rubella virus, cytomegalovirus, herpes simplex virus are similarly psychosyphilitic, and rubella is sorosyphilitic, and they get exteriorized in the form of ulcers in the mouth, cracks on the lips, or measly rash during homeopathic treatment. This we have done enough examples of this. So when there is any complications for all these things, no, like when it has gone into the neuroectoderm, once you start giving the medicine, eruptions will be reproduced, or it will get exteriorized in the form of ulcers, either as aphthous stomatitis or cracks on the lips, etc., during the homeopathic treatment. So that is a good sign. So now, actually, let us come to the conclusion point. Let me read this little faster. It is actually the entire gist of this book is there in the conclusion. It is so interesting to read. Just follow me through the lines, okay? So what is the conclusion? Swati is having some doubts. While treating torch positive patients, is there any order of cure for torch viruses? From the psychosyphilitic, it has to come down. So like if more than 2 or 3 torch is positive, test is positive, no? like cytomegalovirus and all is purely psychosyphilitic. It has to come down first. And then the herpes simplex virus has to come down. And then the rubella virus has to come down. So that will be the order from psychosyphilitic to sorosyphilitic. That is the order, Swati. In case 3 or 4 of them are positive.
Ma'am,
Okay.
like after giving the medicine, first only cytomegalo was positive. Now the cytomegalo is gone and herpes is positive. Is this a good sign or bad sign?
It is in the same plane. It is not a good sign. The vitality of the patient is not improved. It is in the same plane. This is just like jumping from the right side to left side. The patient is having right shoulder pain. You give the medicine, it disappears, and the patient is coming up with left shoulder pain. Can you label the patient as improved? Is there any Hering's law? The disease is jumping in the same plane. So one disease gone and another one of the same intensity of the same miasm is coming up means the medicine has not worked, or rather it will be a partial similema. Okay, Swati. Conclusion. Swati, if you have given some medicine for cytomegalovirus, and like how do you expect the improvement? Not as another viral disease, but as exteriorization. This is what Vijayakar sir says. So when the patient should come up with rashes on the body. I have had cases like that, some HSV or something, and after giving medicine, it was thrown up on the body. The entire body were having that exteriorization. Just like chickenpox, it at least as a crack in the lips, or at least as cracks at the fingertips. No, like some exteriorization should happen. Cracks at the fingertips means what? Not the bloody cracks, but then the ectodermal cracks, mind you, not the third layer crack. You will be getting deep cracks where you will be seeing, no, like it will be as if it is open and it will be gaped, and you can see the redness, or and it will be so very painful. They are syphilitic cracks. I don't mean that kind of cracks. Some superficial desquamation, or maybe the layering of the peeling of the skin will be there. That can be considered as an exteriorization. Superficial peeling, okay, not there. The vitality is lesser, vitality is gone. When the vitality is there, all the dead cells will be so neatly, so smoothly, it will be gone, and new layers will be coming up. That can be considered as a good sign. The peeling can be there upon the lips, and there can be cracks at the corners of the mouth or eruptions upon the lips, all soric cracks, all ectodermal cracks. That can be considered as a good sign. That can be considered as exteriorization. Okay. Hope you understood. Yeah, thank you. Yes. So when you say about cracks, there is so much to say about a crack, no? Okay. So coming to the conclusion, miasm, the taint, as suggested by Hanuman, is not only confined to disease production in human being. It has much far-reaching consequences and a much broad meaning than anybody imagine. The significance of the 3 stages of miasm can be seen in the very existence of man, animals, and plants. Defensive techniques adopted for survival by anything which exists from man to universe. This will give you a broader idea about humanity, about the universe, about any other species. Everywhere you will be able to see the miasm. Reinforce the topic of miasm into your mind. Coming to the paragraph, time, culture, disease, chronology. Very, very important. Couple of centuries before, right up to 60 years back, before the advent of antibiotics and vaccinations, large number of deaths occurred due to the infective and inflammatory. That all the deaths happened because these infections are nothing but soric, or rather sorosyphilitic, as you know now. But then anything can kill you. It was infective and inflammatory. People suffer B3 deficiency, nutritional deficiencies. People died out of famine, out of skin eruptions, out of pellagrass, and infective and inflammatory diseases in those olden times. People died of scarlatina, plagues, pneumonias, measles, smallpox, etc. The tendency of constitutions was more towards inflammatory or psoric diseases. Hahnemann therefore clubbed almost all diseases in Sora. The human race was then in purely nutritive phase. Man was trying to survive, to make two ends meet. He was working and learning so that he will help the human race to progress. There were not many inventions, not many discoveries, which means psychosis was not there at that time. This was the soric phase of man. 20th century saw the sudden spurt of discoveries and inventions. Most of them changed Sora to psychosis. Inventions brought in luxuries, machine inventions brought in ease and facilities, all of which led to prosperity of human race. Nearly all the inventions like electricity, telephone, television, aeroplanes, rockets, satellites, computers, etc., etc., occurred during this period. Things which were discovered to make life easy and enjoyable and allow man to dream to achieve the impossible, allowed man to dream to achieve the impossible. Showmanship increased. Culture and morals went underground. When there is good thing, there is bad thing also, no? When the psychosis is coming up, when electricity is there, telephone, television, it's all good. It has improved our standard of life. It has all given comfort to us. It has all saved time. You don't have to walk for miles. You can rather hire a bus or some vehicle to go. It's all good. But then when the good thing is there, there is a bad thing also. The morals went down. Culture and morals went underground. Showmanship increased. Man prospered, but became greedy for more money, more achievement, more knowledge, more enjoyment, more deceptions, more looseness of characters, causing adultery, debauchery, etc. The invention of the vaccinations and antibiotics changed the face of diseases too. So then there is no more so-called smallpox or such kind of very severe viral infections or antibiotics. The bacterial infections or inflammations are all curtailed. The infections were suppressed. The viral diseases were suppressed. The antibiotics and vaccinations suppressed the primary physiological defense of man. He was not allowed to react on the skin due to usage of ointments, nor allowed to suffer from any inflammatory diseases. He had to survive. Genes started to adopt the second defense, the morphological constructive defense. To some extent, even the destructive defense tainted genes were on the up. So this is comes the development in life and the development in man, development in gene, automatically it goes to the next higher defense and then the next higher defense as well, even the constructive and the destructive defense. In aphorism 81, Hahnemann has indirectly mentioned about the genetic factor, though Mendelian theory of genetics was not discovered at that time. He mentions about an ancient infecting agent, millions of human organisms and attaining an incredible development and rendering it morbid to give great variety of chronic diseases that they are known as the secondary symptoms of Sora. So all these genetically transmitted diseases, maybe Hahnemann would have meant that it could be the genes which are inherited, no, from father to, like, from generations to generations. The disease are passed through genes and they are considered as the secondary symptoms of Sora. He further mentions that this passage of infectious agent, which has brought about the change in disease, genes, no, like how it was shown in the 2-3 generations back, are not shown exactly in the same way, but then it is changed or it is modified, but it is there. So it is transferred from generations to generations. The passage of infectious agent, which has brought about the changes in disease. diseases are also changed. The pattern of the disease is changed because it undergoes adaptations that has brought about corporeal changes. This change, secondary to SORA, coupled with the original soric miasm, makes the injured cell respond differently to produce variety of defects which are more dangerous. This is how the disease, new and new and new diseases are keeping on coming up now. The four-sighted Hanuman has actually written about genes, genetic inheritance, as also genetic mutations 200 years ago. Hanuman did not understand that this was gene at that time, but then he understood that there is some pattern happening. Yeah, this was the era of psychosis. In this era, especially between 1950 to 1980, people suffered more from psychosis diseases like hypertension, hyperlipidemias, diabetes, ischemic heart diseases, obesity, gout, etc. Statistics showed that more number of people died due to heart attacks than cancers or any other infectious disease. There was no syphilis, there was no soric. The soric things are, we have developed more than that, and the syphilitic thing is not yet reached. So people died more of heart attacks than cancers or any other infectious diseases. In short, vaccinations brought down the number of deaths due to infective and viral diseases, that is the SORA. But this gave way to more hidden, more obscure, more insidious, and more chronic form of diseases like the ones mentioned above. That is nothing but the psychotic diseases. Gains in material and shallowness in principles became the order of the day. This was the era of psychosis. After the 80s, man started conquering the unseen. Yeah, now this is coming to the destructive. He went to the extent of controlling the electromagnetic waves, which his senses were never gifted to see, nor to control, nor was he made capable by Almighty to use it for any means. We can't see the electromagnetic waves now, but then we still want to control that. He made technology to make use of electromagnetic waves, radio waves, existence. No, like even not only the radio waves, telephone wave, it has come up much more than that. No, like even the Meta, even the Chat GPT, even the Google waves, the AI, everything is there. No, like to break the bounds of his limited existence. Anything and everything is possible just with the at your fingertip. No, like even at watch, wearing that watch and all. Not just like that. If you shake that watch, you will be able to read the emails through your watch, through your hand sometimes. Thus, no, like I shall give you one example here. One friend of us, one family friend of, he is all good now. No, suddenly he is having the biological clock properly. He's sleeping at the proper time. He's getting up at the proper time. He's going for walk. He's having healthy diet, etc. And we asked him like, how it is a ring, some ring, blah blah. It will control me. It will wake me up. It will give you order. It will give me order. It will ask me to get up. It will form my timetable. Now it is just like some AI thing born on the ring, and that is called as a GF, a girlfriend, and it controls me and it gives me instructions like how to live my life. Yeah. So that is where we have reached now. Thus, he had now at his commands the remote control, the cellular phones, the e-world, the internet world, even all this meta thing and all that. When man's reach goes beyond his bounds, he is entering the syphilis world. Is there any doubt? We are all in the syphilitic world. The wars of destructions with mass destructive weapons and chemical weapons started getting discovered. Terrorism increasing in every nook and corner of the world. Hijacking, bombarding, mass killing have become the order of the day. Even the youngsters love movies having war, slaughter, hideous faces, weirdity, horror, etc. Movies depict distorted versions or perverted versions of classics. The imaginations go beyond the realms of reality to depict Martians with one eye, human dematerializing and materializing. laser cutting through space to enter another unseen dimensions, etc. What are all these things? Nothing but syphilitic, utterly syphilitic, frank syphilis. Teenagers hate classical music and opt for break dance, frequenting discotheques and dancing in frenzy, or freaking out till early hours of dawn. With distortion of conscience and destruction of morality and perversion of sexuality. No work, no study, all play and all joy happens to be their theme. How many of you are resonating with this now in youngsters? They don't get up in the morning, no? They don't see sunrise. Huh? They all get up in the afternoon or what is breakfast. Gen Z, exactly, Nancy. So no work, no study, and all play and all joy. No, they will ask us also, no, Mama, why are you getting up in the morning? You also sit and enjoy. No, come sit with me and watch the movie. What is there in that movie? That's all. No movement, no physical movement. Sitting in the couch and staring only. They grow up without directions. They can never get solace and peace in their life. And are they happy? They are allowed to play video game from morning, having all sorts of complaints. They hunt for peace and solace. They become paranoid, depressed. They cling to drugs. Some opt for wrong fanatic religiousness. All of such kind of teenagers now, they don't have friends. They don't go to school. They don't go to colleges. And they will quit all the studies and suddenly they will come shut up in the room, all depressed, and they are termed as schizophrenic. And they will be having self-inflicted wounds all over their body. There is disgust for life and disgust for themselves, upon themselves. This is the miasm of destruction or syphilis which rules today. Maximum number of patients now suffer from destructive diseases. Diseases like cancers, motor neuron diseases, obsessive disorders, psychosis, insanity, autism, mutism, Parkinson's disease, chronic renal failures, leukemias, and suicides are number one killers. All these things are number one killers today. Thus, the world moves on in circles. The circle of Sora, psychosis, syphilis, and after that, what? Again Sora, again psychosis, again syphilis. And after that, what? Again Sora. Let us hope for that Sora to come. Yes, Kailbiri, the circle of life. How Vijayakar sir has written this book, and with what a visionary he was. How much has he understood Dr. Samuel Hahnemann and homeopathy and the entire universe? We are all really blessed to have such a great guru, Dr. Praful Vijayakar sir. 2 more minutes left. I thought that it is already 11 past. Any doubts? Any quick discussions or anything? Any inputs? Arya is all happy. Thank you, guys. Then let us call it a day. Bye, dears. Maybe in the next class, we will be discussing about the camp cases or something. After that, we shall read the next book, that is Frequent Encounters, which will be very, very lovely. Bye, dears. Love you all.
Bye, ma'am. Thank you, ma'am.
Thank you, ma'am. Thank you.
Yeah.
Thank you, ma'am.
Somebody is asking something about sepia. Yes, thank you, dears. Sepia is given for yes, Mangala Rogni, you are right. Sepia is given for anything which is unknown. Magnetic wave is unknown. We can't see that. We can't experience that. Maybe we can feel that. But then through the electronic equipments, we can feel that. So anything which is unknown, you can think about sepia. Any blessings or any curses, any negative energy, any like ghost-like experience, any that kind of an untoward fears or hallucinations, or not hallucinations, something which is felt really, such kind of things where you don't have any explanations, which is totally new to you, which is kind of metaphysical. You can think about, any vibration, you can think about sepia. Thank you,
Thank
Mangala,
you, ma'am.
for reminding
Thank
that.
you, ma'am.
Yeah. Bye,
Thank
dears. Then
you.
love you all, guys.
Thank you.
Bye, ma'am.